Killian's pretty much introduced me already, so just to say I'm here to talk with Colum. We're going to focus on the Green Healthcare Programme, which we manage on behalf of the HSE. So as Killian pointed out, and I got a bit of a shock when he mentioned it, I'm 30 years with the Clean Technology Centre, but it's been a very enjoyable adventure, if you like, because the whole world of sustainability has been continuously very interesting and changing. Unfortunately, the signs aren't great at the moment, as you probably all know, with climate change and various problems we have with resource efficiency, which we will cover during this talk. But we're going to focus today on what the HSE are doing and what we're doing with the HSE on the Green Healthcare Programme. So I'll hand you over to Colum to do the introduction there.
Yes, I've been actually working with CTC since 2002. I came in on a 6-month project thinking that I'd be in and out, and I got stuck because I'm kind of fascinated by CTC and everything that we've done. I'm a chemist in my former existence, and I think what always struck me about the work we do, so a bit about the centre. It was established by 2 chemical engineers from the then RTC, Noel Duffy and Dermot Cunningham. And they were working with the pharmaceutical industry in Cork Harbour, which at the time in the early 90s had an awful lot of bad press because of the pollution issues in the harbour. And the whole premise behind what Dermot and Noel tried to do was to look at the wastes that were arising, predominantly the hazardous waste at the time, and to try and prevent them at source. And through all the years and all the different sort of projects that we've been involved in, that ethos is still underpins everything we do. We try and use data and information to look at where problems arise and try and mitigate those problems before they arise so that the wastes or the issues don't have to be dealt with afterwards. In terms of what we do, this is a kind of a summary of it. We do research. Research is hugely important to what we do. Facts and figures are very important. As Killian mentioned, we do waste characterization statistics for the EPA every number of years, and while routing through bins, which is something that we ultimately have to do, is a pretty grim and horrible experience. It's fascinating in its own way, and I'll never convince you that that's the case, but it kind of is. So we provide information behind national programs, and we take the research, and we're in the fortunate position that because it's applied research, we get to apply the findings. And we do that then through running national programs. So Killian mentioned the Stop Food Waste Programme. Through some of the waste characterization work that we were carrying out, there was the realization back in 2008, 2009 about how much food waste was actually going into the bins. And out of that, we started working on the Stop Food Waste Programme, which is about householders and helping them prevent food waste. And from there, we got into behavioral science, which, from a chemist's perspective or a scientist's perspective, is a hard one to manage, going around and trying to figure out the different reasons behind it. And even though that was about food waste, the learnings that we got from that can be translated into everything that we do today. Training is another core part of what we do. We learn with all the different projects that we've been involved in over the years, and we try and translate that into training for a variety of different people and audiences, local authorities, sectoral organizations, some of the students that we would work with and lecture to. So it's about taking real life experiences and real company experiences and trying to translate that into stories, which then precipitate change. And then we still do direct consultancy with a variety of different sectors. So just with regard to the Green Healthcare Programme, it started in 2009, so we've been doing it for quite a while. It started at the time looking at waste and the minimization of clinical waste and has a clinical waste predominantly in the sector. And in about 2015-16, we started working on the water aspect, which is what I'm going to talk about. It was a pilot project at the start, and that's how a lot of these things start. Somebody's good idea, it got funding from the HSE and the EPA at the time. The HSE, it's now funded through the Capital and Estates Sustainable Infrastructure Office, which is a relatively new office. And I think what this reflects is the ever-changing landscape that James spoke about. There was no Sustainable Infrastructure Office when we started. It was just the HSE and the National sort of Sustainability Office started around the same time. So there is an ever-changing infrastructure in the healthcare service looking at sustainability, which is an amazing thing considering we've been doing it for such a long time. I'm going to hand back to James, but I will be back in a minute. James.
Okay, so I'm going to ask these wonderful chemical engineers, how many planets do you think it would take to sustain the human population by 2050 if we all lived the way we do today? The answer's up there, three planets. So the problem we have at the moment is that we all of us in this room in particular, because we live in the first world, we consume more resources than the planet can sustain. So in terms of energy we use, materials we use, food that we eat, the burden, the footprint of that on the planet is not sustainable. The planet can't deliver that continuously. So in order for us to actually have a more sustainable planet, we need to do more with less. And that's where the idea of waste prevention came from when the clean technology was first set up by Noel and Dermot 30 years ago. They were looking at waste prevention to try and do more with less. So today it's the same situation. And I have a mention there of the Earth Overshoot Day. And that's a measure of how much resources a country uses. And in the case of Ireland, we use up all our resources within the first 4 months that would be sustainable. So we would need in Ireland 3 planets to live the way we do. In other countries like Indonesia, I think they live within the 1 planet. So it's an interesting, have a look at it sometime, the Earth Overshoot Day, and look at all the various countries. There are other countries worse than us, you'd be glad to hear. Well, that's not a good thing, but the States, for example, United Emirates, etc. So coming back to the HSE, and I mean, the HSE are part of a government organization, and the government has a climate action plan, and we got to reduce our emissions. And the HSE, unlike any other government organization, needs to reduce the impact on the planet and the carbon footprint. And the HSE set out its climate action strategy in 2023, and it has 6 aspects to it. One, looking at sustainable buildings, making sure that the buildings are energy efficient, for example. Transport and mobility is a big part of HSE. So, you know, ambulances, even how the employees get to work. So they had to look at how are you going to minimize the impact there through encouraging people to use public transportation, for example. Sustainable procurement is important. Greener models of healthcare. Water and waste is the area we focus most on through the Green Healthcare Programme. So we're helping the HSE with this strategy, and adaptation and resilience. So the Green Healthcare Programme, and we have our own website where there's a lot of resources that are useful for anyone to use, but particularly the HSE. So we focus on water conservation, waste reduction and food waste minimization, and energy efficiency. And we do that through a number of measures. We do on-site assessments. So as Colum mentioned, we go on site and we go through bins and we identify the types of waste that are in the bins, and we see what waste is in the wrong bin. And a huge amount of waste prevention is identifying what waste should go in the right bin. And if you have, like really in any business, only a small percentage, like maybe 10% of the waste should be going to landfill, and the rest should be recycled, if it was really in an ideal world. However, that's not the situation. So we do need to encourage people to do better segregation in the workplace if you are to get better, better waste management. We do a lot of on-site and online training. We do a lot of data analysis, and Colum is going to be talking about the wonderful work that has been done in terms of gathering data on water from the various hospitals and benchmarking the consumption from the various hospitals. So there's no one hospital has the same benchmark. They all use different amounts of water per bed day, and that's how it's measured, I understand. We also do case studies. So case studies are great, and we're going to talk about some of the case studies tonight, which can share information of how best practice should be done in terms of sustainability. We do a lot of awareness with staff, and we produce a lot of materials to help staff increase their awareness on the sustainability issue and on climate change. And we also have an online sustainability tool, which I'm going to talk about in a while. So here are some of the materials that the Clean Technology Centre has produced on behalf of the HSE, which can be used to raise awareness in the workplace. And it's very important to get staff engaged, especially with regard to, say, waste management, but also in relation to things like energy. where turning off the lights and not using the printer and various other things, they can make a big difference in terms of managing energy. There's a sign there for bin and what waste to put in the right bin. As I say, waste segregation is essential. We also produce guidance documents. There's one there on water efficiency, and there's another one there on resource efficiency in community nursing centres. So there are just some of the examples of the documentation that Green Healthcare has produced. So Colum is going to talk about water now in quite a bit of detail, and then I'll come back to you on waste. Thanks.
So I'm not going to get into fluid dynamics because I know I'm here with engineers, and I wouldn't go there because fluid dynamics is a very challenging area, and it hasn't changed really for an awful long time. What has changed, though, is our appreciation of water, especially in this country. You know, I'm not going to say just because it rains we should have plenty of water. I think we all know that that's not the case. But the thing about the HSE is it's huge. So I think about 2,500 sites around the country of varying different sizes. And hopefully most of you guys won't need to go near there for quite a long time on a regular basis, but it is a crucial part of our day-to-day. And it's a really unique environment when you look at it. So we started working in the healthcare service, you know, because we got talking to maintenance staff when we were out and about, and they were telling us about some of the things they were doing. And it's a fascinating area. It's, as I say, it's part pharmaceutical industry because you've got the use of ultra pure water. You've got a huge issue with Legionella management, which is a bacterial growth, which can cause huge problems. And there's an unbelievable amount of time, effort, water, and energy that goes into making sure that there are no Legionella issues in hospitals, because obviously it has a huge impact on the most vulnerable who are in hospitals. And then as part service industry, because you're providing food on a daily basis, toilets, taps, all that. So it's a really unique environment in which to work and to consider water. And when we started doing this, there was no benchmarks, there was no Irish-related data in 2015-16. We were actually using UK-based data from the 1980s. I was born in the 80s. Hopefully none of you guys were, other than the three or four who were older. But that's how poor it was when we started. And we've come an awful long way since then. In terms of costs, it's virtually impossible to get a handle on it because it's such a massive organization to try and get an accurate number on the amount of water and the cost of that. I reckon it's probably closer to 20 million a year, and that's just for the water supply alone. That's not including the heating costs, which I'll come back to. And from a decarbonisation perspective, and that's a huge driver of national policy and has a significant driver in terms of what we're doing here in MTU, but also what the HSE are doing. This decarbonisation aspect of water conservation is something that's really driving the agenda. And there's the continuity of supply aspect, you know, so every hospital has to have water. It stops, they're in big trouble. And they have storage tanks for sure, but those storage tanks can only last for so long. So the more efficient a hospital is, the longer it can operate in terms of emergencies when water does go out, and it does go out periodically. So, question. I actually didn't think that was going to come up. I was going to ask you, did you know how much water a typical hospital like CUH would use every day? So we do it. It's actually it's up there at 500 cubic meters. I'm not sure if any of you know or have seen a cubic meter of water, or let alone 100 of them, or let alone 500 of them. So I was trying to think of what is that, you know, in terms of 2-litre bottles, because we all know what a 2-litre bottle of milk is. So 250,000 2-litre milk bottles a day worth of water, obviously not of milk, are used by CUH. It's actually north of that. So, you know, that's a lot of 2-litre water bottles. And if you think about that over a year, that's 100 million. One hospital, and we've got 60-odd acute hospitals, which would be hospitals of size, and then you've got, you know, probably another 200 or 300 of smaller ones. A huge amount of water being used every day. For essential services, it has to be said that this is not all wastage. This is for crucial services, which we'll come back to. So how we work when we put on our Superman tops is we take a sectoral approach, because ultimately this is a very unique sector, as I spoke about. And we start with data. and national benchmarking to try and figure out how good different hospitals are doing relative to each other. And this is the engineering part. We have to have good information. We have to have good data to support the things that we do. James spoke about it, about empowering people. It is amazing that when we go in and we do information sessions or training with green teams in hospitals, we ask people, do you know how much this hospital is paying for water? And they don't realize that they're actually paying, there is a charge for water. There has to be. At the moment, every cubic meter costs about €3. If you think of it, that's 1,000 litres for €3. That's a really, really good deal. The thing is, it's probably undervalued compared to European countries. It's about €5 per cubic meter there. With the increasing energy costs, it's likely to go up. And what's interesting about water costs is that you've got water in, which is actually not too bad in terms of the energy that goes into it. The treatment of wastewater, the water coming out, is actually very expensive, and especially coming out of hospitals where you have so much clinical stuff going on. So we want national benchmarks, and we want empowering, because we need to work together, and we need to work with maintenance teams as well as staff and people that visit. James spoke about case studies. We want evidence-based case studies. We work in a public service which is beset with this mentality of cheap is the only way to go, and sometimes you have to invest to save, and that's a hard thing to do. So we want evidence-based case studies, and then collaborating with, I guess, national stakeholders. So we would work very closely with HSE. HSE is really interesting because they took 34 water databases. So if you think about the history of water in Ireland, it was set up in local authority areas. So there was this really close relationship between water users and obviously the water department within local authorities. So you had 34 local authority areas which were merged into one HSE. And it's 4 or 5 years on, and we're still trying to get our databases right in terms of information. So it is very, very challenging, but what we do is we underpin it with the EMS approach. The Plan, Do, Check, Act, so this continual improvement approach, which should underpin work in every business, is what we do. One of the things that we often forget about when we think about an EMS, though, are the people. And that's what James was talking about as well, the training and the engagement. So just to go back to benchmarking, if you saw that profile, what would you think? Doing good, doing bad, anything jump out at you? When I look at that, I go, fairly consistent, things are grand, not too worried, everything should be fine. When we benchmark, and as James mentioned, we benchmark by looking at how much water used per whatever factor. So in certain industries or in certain businesses, you might look at it, in a production business, you might look at it as tons of output, product output. In an office space, it might be based on floor area. In hospitals and in the healthcare sector, when we're benchmarking water, we look at it per patient bed day. So if we know that a hospital has 800 beds, we say, okay, we assume 100% occupancy, because that's where they're pretty much always at. We multiply that by 365 to get the number of patient bed days facilitated over a year. And then we divide that into the volume of water. And when we benchmark this particular hospital, it's the orange one. So even though everything was consistent, we know by having these benchmarks how well hospitals are doing or not. And this is our first line of defense. And we do this now on an annual basis. And it's hugely important because it means we can identify those hospitals which are above and beyond. The one caveat I would put into this is that every hospital is different. Some, say CUH, will have a maternity wing, which is a large consumer of water. Others will have dialysis. So CUH has that as well. So that's another huge consumer. So they all have different makeups. So they're not always going to be the same, but we tend to band them, and we can band them. Sorry, I thought wrong slide again. So I'm going to come back to this. So the first part about benchmarking is that we can see where the big users are. The other part about benchmarking and good data is it allows us to see whether we're being efficient after the fact. So this was a leak in a Cork hospital, actually, over 4 months. I'll tell you the story behind it. Any idea, just off the top of your head, how much that leak might have cost? Okay, so 37 grand for a leak in a hospital over 4 months. And the story behind this was that there's your mains meter is at the road, And there's a storage tank up here, and the guy who is the main maintenance guy would check him on a monthly basis. He was going away on holidays, he forgot to check it. He came back from holidays, it was very busy, and it had been very wet. You can see the date there, it's April, May. And when he realized it, when he went and did his check there in the 3rd month, he realized that there was a huge problem. It was a very simple fix, it was above ground, but because it had been wet, nobody had seen it. And the reason that this happened is because they didn't have any early warning signals, because when it comes to water, we don't tend to have online metering, which is a huge part of what the HSE is now doing. So I'm going back to the benchmark, sorry, these were mixed up. So the benchmarking now that we have on an annual basis, we update it, and we have kind of bands so you can see where hospitals are. It's not a set in stone thing, but we have this now as, as I said, a first line of defense for hospitals to consider. And these are based on statistical analysis of the data that we get from Ishke Éireann on an annual basis. So going back to the metering and the information. So as I said, fluid dynamics pipes, they haven't changed. What has changed is the sort of IoT technology that we have. So in the last year or two, we realized that we had a dearth of information, that we had no power, we didn't know what was going on. And a lot of different businesses have been doing it. So what we've started doing is trying to, trying to get a system where all the information on a hospital is available just visually, because I think visually is very important. So we developed this healthcare focus system. We have a whole bunch of different users or sub-meters within the system. And then over here, this is the crucial number here. We're at 67.6% in this particular hospital. Our goal is to have at least 80% of it sub-metered. But you have to realize that these sites have evolved over sometimes over 100 years. You're talking about old infrastructure, leaking out water. And in the healthcare system, where water gets out, dirt can get in, and where dirt gets in, bacterial growth can happen. And this is a huge problem. And it was really interesting that when we shifted the kind of the focus of our conversation away from losing water to dirt getting in, it was interesting how more and more people became very interested in this aspect of what we were doing. So just to show you a couple of things, that's another one, so we can break it down now by area, so you can then end up identifying the large users. We're also using AI. So once we have data for 3 or 4 months, the red line here is the kind of the profile. So we can use that to predict what it should be. And from that, if there are any huge jumps over it, like this looks a little bit weird, but it might happen on one day. If it starts happening on a consistent basis, then we know that there's something untoward happening. But it's about using the technology that is continually developing to facilitate the managers on the ground manage water better. The other thing that's really interesting about sort of use profiles is that in a hospital, they become very, very consistent. What happens on Mondays are usually a little bigger. Monday, Tuesday, Wednesday, Thursday, Friday tend to be quite consistent, as you can see here. So this is obviously, this is a Saturday, a Sunday, Monday, Tuesday, Wednesday, Thursday, Friday. So that's 1 week. So the daily profiles are very consistent and the weekend profiles are very consistent. So again, it's about gathering data and using it constructively. Another thing that we do is we go out and we do actual measurements. So these are tap surveys where we go out and we measure flow rates. And what's interesting about this is that you can have two rooms, 2 wards right next to each other, same taps, different flow rates. Go figure. How does that happen? And it happens for a whole bunch of different reasons. People are tweaking things here. There's good pipes, but without this hard data, we just don't know what's going on. And when we put this information together, a recent hospital survey, these are the results. So if you look at flow rates for hand washing taps, it should be under 5 litres per minute. We kind of broke this down under 10 litres per minute. We were being nice. This really should have been under 5 litres per minute for green. But if you look at this, 70% of the taps are above 10 litres per minute. So if you're using those taps day in, day out, there's a huge, wastage of water. And, you know, these are historic taps. They've been there for a long time when we were much more fluhuluk and less about water. So that's hot taps, which has the additional issue of the heating associated with it. Similar profile for cold taps, again, 70% above your 10 litres per minute. And then these are the mixer taps. These are the newer taps. And you can see the improvement in efficiency across the board. So again, it's about using data and measurement to provide hard case studies for then the investment. And this is another piece of work that we did. So we were trying to figure out, we know all this water is being used. Where is it being used? And there was one hospital which was set up with the 3 different types of water that are used. So you've got hot water being used, you've got cold water, and then you've got sluice water or flushing water. So that's for your toilets, for sluice rooms and things like that. And we found that 43% of the water was hot water. So you've got your embedded energy in that. And that's a huge driver for decarbonisation. And that's really been reflected in the recent climate or sustainability strategy. Going back to some of the case studies, Sligo University, it took them 4 years or 4.5 years to replace all their taps within their hospital. They're saving 5,000 cubic meters a year. Again, we go back to, I don't know how many 2-litre milk bottles that is. Maybe some of you guys would be good. But they save 48 grand in the year. And of that 48 grand, 15 of it was related to water, 33 was related to the heating of that water. Interestingly, from a carbon perspective, the biggest improvement and the biggest impact was the heating of the water. So that's your scope 1 on-site heating of water. I was actually just at a talk today with Ishcare. They said that they're reviewing the carbon impact of water supply and treatment. So that 2 tons of CO2 equivalent for your 5,000 cubic meters is likely to go up as they've revised their figures. But the main thing here is this is your on-site heating. So this is a hugely important aspect of it. And again, this is CUH. We were talking about Legionella management. So they have changed their shower heads from ones that were kind of 16 litres per minute down to 8 litres per minute. But the showers actually work fine. But the key thing here is if you look at the difference again between this carbon saving for the water, which is 11 tons, and 211 tons for the heating of the water. That's where the savings are. And from a climate action perspective, that's what needs to change. This is another case study, again, the importance of sub-metering and data. I won't go into all of this, but it's based on a little bit of sub-metering, which is putting meters strategically around the site. They identified that they were wasting about 13 grand's worth of water in the background, day in, day out. So that's the green line there. So again, it's about using data constructively. I just wanted to talk, before I finish up, on reverse osmosis, because it's one that I'd love to do more on. But within the healthcare sector, there's always a hesitancy because of infection control and verification about what you can do. So with regard to reverse osmosis, which I'm sure a lot of you are well aware of, you take your water, you soften and pre-treat it, it goes through a membrane, and you use the ultra-pure water out here. The thing is, you discharge an awful lot of water, and it's amazing. People will often talk about it as wastewater. It's not wastewater. Wastewater is what goes down the toilet. This is wasted water because it's actually perfectly good. And huge volumes come out of reverse osmosis units within healthcare facilities. And in a lot of other industries, they reuse this water constructively, but traditionally it hasn't happened so much in the healthcare service. So you can actually reuse it. And one of the things that we do is we analyze that water. So if we look at it here, this is an assessment of the discharge of wasted water from an RO. And the red line here is the limits for potable water. So this is what we should be getting as from a kind of consumer perspective. And the discharged water from ROs satisfied all of the potable water limits. So it can be reused within hospitals for a variety of reasons. And this is just a case study from Tullamore Regional Hospital. They invested 10 grand to reuse the water, and they saved 12 grand in a year. That's just ignoring all the carbon savings, just pure cost. So a payback of over a year or less than a year, which from a business perspective is really good. So I think that's me. That's a whistle-stop tour on water. There was an awful lot happening there. Hopefully it was of interest. James?
In relation to waste management in the healthcare sector, we could talk about this all day, but unfortunately I only have 10 or 15 minutes, so I'll give you some facts and talk about some case studies. So it's interesting, the price of waste. So, it varies hugely depending on how much treatment is needed of the waste. So in the case of the healthcare risk waste, purple, black and purple, which would contain nasty things like body parts and placentas, etc. They have to go for a special type of incineration, and that's exported abroad and it's quite expensive. So that's 2,000 euros a ton. Other healthcare risk waste, contaminated plastic, needles, etc. That goes for sterilization and incineration in Ireland, so it's not as expensive. If you go back down to general waste, you're talking about 200 euros a ton, food waste 150 euros a ton, and recycling 150 euros a ton. So you can see why, despite for environmental reasons, the HSE would be very keen for staff to segregate waste into the right bins. Because if you're putting newspapers into clinical waste bins, it costs you up to 2,000 euros a ton to incinerate your newspaper. It's quite an expensive way to do it. And believe me, that does happen. So segregation is key to reducing costs. To reducing the environmental impact, you have to go back and look at prevention, stop the waste occurring in the first place. So we do, as I said earlier, we do provide signage for staff in the healthcare sector. And Colum actually mentioned the waste characterization study that we did nationally. And we found that the healthcare sector was one of the best business sectors in terms of waste segregation. They do a good job generally in that. So fair dues to the HSE staff. In terms of food waste is on the Climate Action Plan agenda, and every public sector has to reduce food waste by 50% by 2030, and that includes the HSE. Because food waste does have an environmental impact and has a carbon impact as well. When it's actually degrading, it gives off CO2, but also in the production of it, creates quite a lot of carbon. And the cost of food waste is really interesting because, when you get food waste collected, and this applies to home as well. So a wheelie bin at home, the brown bin, that costs 200 euros a ton to have it picked up and taken away. But the actual cost of what's in the bin is up to 2,000, it's at least 2,000 euros a ton, or 2 euros a kilogram. So it's estimated that the average Irish home sends away about 1,000 euros a year of food waste. Put it in the bin, send it away. You're wasting all that good food. So, there should be a focus for everybody to reduce food waste for environmental reasons again, but also for cost reasons. And there's lots of ways you can do that. One really interesting case study, and this has come about recently, where patients order their food through electronic means, which means they can order the food on the same day and it can be prepared for them within a couple of hours. Historically, the patients used to order the food the day before. So you'd be asked, what do you want tomorrow for your dinner? And someone would come along with a pad and take a note and say, Mary McCarthy wants steak tomorrow or mince, whatever. And next day, the meal would be delivered to Mary's bed. Now, Mary could have gone for an x-ray or she could be discharged, but the food would arrive anyway, and then it was just wasted. So with this, it's very effective, it's fast, and it has been proven in some of the hospitals that food waste was reduced from 30% to 8% in one private hospital, 8% of the overall waste. And in public hospitals also, this has been achieved. And this system is being rolled out. So that's a really good, innovative way of using technology to minimize food waste. Of course, it's not only about, the food that's delivered to the patients, it's food in the kitchen that's prepared. You have to ensure that you don't overproduce food waste, because that can happen quite a lot, that too much food is produced. Too much potato, for example, too much broccoli is a good one that people don't want to eat, and that's thrown away then. In terms of another study that was done by our colleague, I'll have to give Eileen O'Leary credit for this. She did a lot of work in the Cork University Maternity Hospital, one couple of days, maybe recently. And what she was doing was looking at the amount of milk left over from the baby bottles. So after the baby's had his feed, how much milk is left over? And she found that 2 out of every 5 bottles had more than half left over. And 1 in every 10 had 70% of the milk wasn't drank. So basically, the amount of milk in the bottles was too much. The bottle size was 70 mils, but staff reported that the average amount of milk that a baby drank was about half that, 30 to 40 mils. So it's estimated using this, this study that the healthcare sector, the HSE, could save about €100,000 a year by ordering smaller size bottles. Of course, it's hard to order them because the producers of these milk products only want to give you the 70 mils. So it's interesting that a scientific paper is now being produced by the doctors in CUMH to encourage suppliers to reduce the volume of the bottles down to possibly down to 40 mils. And that would have an incredible amount of savings in terms of a simple solution, but an interesting study all the same. When it comes to food waste, I suppose generally there's always going to be some food waste, and you know what some of the hospitals are looking at now is treating the food waste on site through compost system like this one here. It's an in-vessel compost system. So certain amount of waste, not all of the food waste, because like bones wouldn't be suitable for this, but you put them into this container and it composts it with heat is injected into the system, and over time it breaks down and you have this nice compost which can be reused on site then for the facility in the gardens. So in the case of Sligo University Hospital, this system is now saving the hospital about €1,500 a year. And that's after the costs of running the machine itself. So it's a great system in actual fact. Another waste prevention case was in the theatres, where one of the surgeons was doing a study using Lean Six Sigma to do a study on how the materials that were being produced in preparation for theatre operations, and they found that they were overproducing the amount of anesthetic. And by reviewing that and coming up with more a streamlined methodology, they were able to reduce that by 18%, which actually reduced the cost of anesthetics by €50,000 a year in this one hospital. So a very simple solution again, but a lot of savings. So they're just some of the case studies on the in terms of waste and the lots of the various things that we are doing with managing waste. Another, and this is the last topic I wanted to mention, was an online tool called the HSE Sustainability Online Tool. And the idea of this was to create a system where facilities that, smaller facilities like the community hospitals, our primary care centres, could get some advice and assistance on sustainability, because there's thousands of them throughout the country. And there aren't enough staff, I suppose, really, to facilitate and help all of these facilities at any one time. So this online system allows facilities to go in and answer about 40 different questions. And they then, based on the answers, which are multiple choice, they will get a score back to say how sustainable they are. And in response to those questions, they will also get some advice and assistance. So they'll actually get a report recommending some actions that they can undertake to make their facility more sustainable. So this is been rolled out at the moment as a pilot program, and it's working quite well. And it's based on another system that we developed ourselves in the Clean Technology Centre for general business. So it's based on that. So the objectives of the sustainability tool are to introduce management and staff to the key questions associated with utility management, sustainability, and climate actions. So it's about awareness raising again, and raising the bar in terms of knowledge in the community on sustainability. And some of the things that have been identified, and these are all based in Cork and Kerry, because this is where we're doing the pilot. For example, a hospital down in Youghal identified that they could reduce landscaping costs by 80% and increase biodiversity. And that was a very simple thing, cutting the grass less. Because what they were doing was we had this contractor coming in, cutting the grass, a field of grass every couple of weeks, and there was no need for it basically. So they're reducing a limited amount of grass now, are cutting a limited amount of grass and leaving it grow wild, which is having benefit to biodiversity. Quite a few facilities we have found sometimes have poor controls of their heating, and heating is expensive because you're having to heat the building and there's oil being used and fossil fuels. And in the case of Mallow Hospital, we identified how they could reduce the cost of heating by just having better controls on the boiler and on the radiator valves. In Skull Community Hospital, they've changed all the lights out now from fluorescent and halogen bulbs to LED lights. And as you know, LEDs are very efficient. We have them here tonight. And we've also looked at renewable energy is another really great way of reducing fossil fuel usage. And it can contribute to a significant amount of electricity in a facility. So it is being rolled out slowly within the community hospitals. So just a few pictures here from our visits, you know, putting in solar PV, reducing the flow rates in the taps, as Colum pointed out earlier, can make a significant difference on carbon as well. Changing the lights out from old fluorescent tubes like these ones to LEDs gives you better quality lighting, lower costs, and improving the controls in the nursing area, for example, here on lighting. And training people on how to control the lights can have a major impact. So I suppose just wrapping up really, before we get to questions, there's some links there to some of the relevant websites, the Green Healthcare website that we run ourselves, and the HSE Sustainability website, where you can get a lot of information on what they're doing. So we're open to any questions, and if anyone wants to contact either myself or Colum, we have our emails there. So that's us, that's from us, and if you have any questions, we're happy to take them now. Thank you.